Hi, good morning, students. I think you are all well and enjoying my videos on YouTube. And in previous class, in previous section, I taught you about cartilage and bones. Okay, and now we will cover vascular tissue. The next topic is vascular tissue. Vascular. Vascular tissue is also known as fluid connective tissue. This is the softest tissue in the body of human, in the body of mammal, in the body of red blood animals. Okay, so this is the vascular tissue, fluid connective tissue, also known as fluid connective tissue. Do you know what are the special features of vascular tissues? Okay, so first I would like to explain about some features which makes it vascular and fluid connective tissue. Okay, so the first point is that consists of fluid matrix and free cells. Okay, so this vascular tissue is made up of fluid matrix and free cells. The matrix is without fibers. As you know, in earlier classes, I told you about except the blood vascular tissue, blood or either vascular tissue, all remaining all tissues having fibers except only fluid connective tissue. Okay, so the matrix is without fibers, okay, present in it. Vascular tissues transport the materials from one place to other. This is the special features of fluid connective tissue. Okay, if you are going to next section, explanation section, let's see at outline that is given in a diagram which explain all parts of fluid connective tissue. Okay, so the matrix of fluid connective tissue is made up of, it means this fluid connective tissue is further divided into two parts, namely blood and second one is lymph. Okay, blood is further having plasma and formed elements, it means blood cells. In other hand, you can see and at the outline, lymph having plasma and leukocyte. Okay, is it clear now? The formed elements are further divided into three kinds. Erythrocytes in short form, the well-known short form is RBC, and leukocyte, the well-known short form is WBC, white blood capsules and white blood cells in RBC. For RBC, the abbreviation of this RBC and this full form is RBC is red blood cell. The last one is thrombocytes. Thrombocytes, I think you well familiar with terms, the terms that is thrombocytes, and this is also known as platelets. Okay, here I have explained with the help of a diagram that you are seeing well. The leukocytes are WBC, is agranulocytes and granulocytes. The name is clearly written here, agranulocytes and granulocytes. It is clear that A means absent and granulocytes means having no granules inside the cytoplasm of that cell. In other hand, granulocytes, it is clear here having granules in their cytoplasms. Okay, A granulocytes is further divided into two kinds, that is lymphocytes and monocytes. Okay, lymphocytes here is a diagram of both lymphocytes and monocytes. Okay, nucleus in both having both lymphocytes and monocytes and cytoplasm. Okay, eosinophils, basophils and neutrophils are the kinds of granulocytes. Okay, and the different diagrams of comparison of erythrocytes of different vertebrates. Here I have drawn different types of diagrams of different vertebrates of erythrocytes. Okay, and it depicts that the fish having among all erythrocytes of different vertebrates, the erythrocytes of fishes are smaller in size. Okay, clearly smaller in size, and amphibian in other hand, amphibian having larger what erythrocytes. Okay, so is it clear? I think all things are given here, and this is a summary of vascular tissue. Okay, this is the summary of vascular tissue. Now we will move on next topic, that is I have summarized the all types of fluid connective tissue in a summarized way, and this is the gist of this topic now. Gist of the topic now in other words, you can say this is the summary of this topic. Okay, so while seeing the diagram, we can discuss about this topic one by one. Okay, now is the first column, it is given the name and number and percentage of erythrocytes, leukocytes and so on. The first one we are seeing here, the erythrocytes, RBC, red blood cells. Okay, then in male 5 million cubic mm of blood is present. Okay, that is 5 to 6 liter in male. Okay, in female the 4.5 mm of blood, cubic mm of blood is present in compared to male, and female having less amount of blood due to menstruation period is taking place in female. Okay, number increases during exercise and at altitude. Okay, size 7 to 8 micrometer, and its weight is about 1 to 2 micrometer in height. Okay, clear. So this is the erythrocyte of number, percentage and volume. Okay, the color and the structure of erythrocyte is, look, yellow when seen singly. Okay, when we see singly, the color of erythrocyte is yellow, and red when viewed in bulk. When we see in a bulk, this is the color of the erythrocyte is red. Okay, the shape of erythrocyte is circular, biconcave, and denucleated and elastic. Plasma membrane, homogeneous cytoplasm with hemoglobin, cell organs. These are all absent in RBC. Okay, and in mammals RBC, there is no plasma membrane, and all cell organelles are absent in RBC. Okay, formation and lifespan. By yolk sac, in the early few weeks of embryonic stage, by the liver and spleen, later from the birth onwards by bone marrow. Okay, and the lifespan of this RBC is only 120 days. Okay, so here is if you have confused, like what is written here, by yolk sac. Okay, by yolk sac. Is it clear now? The formation of RBC, okay, uh, is in Yorkshire when at the time of embryonic stage, and after birth the RBC is formed by bone marrow cells. Okay, the main function of RBC is transport of oxygen and some amount of carbon dioxide. Okay, now the second one is leukocytes, in abbreviation WBC, white blood corpuscles. 5,000 to 10,000 cubic mm of blood, and number increases during infection. Okay, colorless, this is a colorless liquid due to absence of RBC. Rounded or irregular, nucleated, this is nucleated, 12 to 20 micrometer wide, and its formation is from bone marrow, lymph nodes, the spleen, thymus, tonsils, and pairs patches of the small intestine. Okay, these are the site of formation. Act as soldiers, scavengers, some help in healing. Okay, these are the functions of leukocytes. Now, the first one is A granulocytes. A granulocytes, cytoplasm lacks granules. That's why this is known as A granulocytes. Nucleus not lobed. Okay, nucleus is not lobed. The A granulocyte, the first kind of A granulocyte is lymphocyte. Lymphocyte is 20 to 45% in amount, and the large rounded nucleus is scant cytoplasm. Okay, scanty of cytoplasm. There is some less amount of cytoplasm. That is the meaning of scant is here. Lymph nodes, and the formation of lymphocytes is taking place by lymph nodes, spleen, and thymus, pairs patches, life few days or months or even years. Okay, and motile, non-phagocytic like a function, and secrete antibodies helping healing. Okay, these are motile and non-phagocytic. The second one is monocytes, 2 to 10% in amount, largest of all types of WBC. Okay, the question may be asked, like which is the largest WBC in the cell, blood fluid, connective tissue. The monocyte is the largest of all types of WBC. Nucleus bean shaped, enough cytoplasm. Okay, enough cytoplasm, and the formation site is bone marrow, life 10 to 20 hours only. Motile, these are also motile, phagocytic, engulf germs and all debris often genocytic in nature and macrophages. Okay. Now the second one is granulocytes. Cytoplasm has granules, nucleus and lobed. Okay. The first granulocyte is eosinophils, 1 to 6 in percentage, bilobe nucleus, coarse granules in cytoplasm, take acidic state. Okay, its formation site is bone marrow, life 4 to 8 hours only in the blood and 4 to 5 days in the tissue. Non-phagocytic, have antihistamine properties. Okay, anti-allergic properties, play role in immunity. Okay, next one is basophils, 0 to 1% in amount, usually 3-lobed nucleus, less number of coarse granules, take basic stain, bone marrow, life 4 to 8 hours in the blood and 4 to 5 days in the tissue. Release heparin, histamine and serotonin, these basophils releases, thus they act like Bast cells of connective tissue. Next one is neutrophils, 40 to 75% in amount. Many lobe nucleus, fine granules, take acidic as well as basic stain and its formation site is bone marrow, life 4 to 8 hours in blood and 4 to 5 days in the tissue. These are phagocytic in nature, engulf germs and dead cells. Okay. The last one is platelets, that is thrombocytes. 250,000 platelets per cubic millimeter of blood. Colorless, these are also colorless, rounded or oval, non-nucleated and fragments of the cell. These are also called fragments of the cell. Bone marrow about a week. Okay, the formation site is bone marrow. Help in blood clotting. So in this video I mentioned about fluid connective tissue and its kinds, RBC, WBC and platelets. Okay, so and this is brief explanation of fluid connective tissue. Okay, that covers all NCERT and somewhat sidebook syllabus. So thank you for watching video. Again we will meet soon in with the next topic. Okay, then thank you. Bye bye. Hi, good morning students.